Hey guys, we're back with you this morning for another Breakfast with the Banner. It is Wednesday, November the 17th, and we have got a very special guest with us this morning. A very special guest from Madisonville, Kentucky, Miss Alex Strein. I want to make sure I pronounce that right.
It's like Stein, but more aggressive.
More aggressive, okay. And she is from BrightView. Now, is it behavioral health? How do we want to go about it?
The actual company name is BrightView Health.
Okay.
And we do outpatient substance use disorder treatment.
Okay. And of course, this is a topic that we haven't talked about. We haven't, even broached this topic before here on Breakfast with the Banner. So I'm going to let Alex talk about what they have to offer. Of course, like I said, this is in Madisonville, Kentucky, for where Alex is from. And of course, you have offices where?
Everywhere.
Everywhere. Okay.
We at the end of the month we'll be at 51 centers throughout kind of like the southeast, Ohio, Kentucky, Delaware, looking at the Carolinas and Virginia.
Okay, so it's really quite broad.
Yeah.
Okay, well this is great.
Our Benton Center should be open probably next month.
Okay.
So we're kind of hitting everybody right in the middle between Madisonville and.
So this is where you
centers.
said you were going to Benton on your way from here. So it really worked out good for us this morning that we got to have her in this morning. And of course, BrightView is, in the times that we live in, especially now, services that you guys offer is very much needed.
Absolutely.
Very much needed.
Absolutely.
Now I know. Did you go to college? What did you go to college? Did you go to college for this?
Not exactly.
Okay.
I knew I wanted to be in healthcare, but I'm not exactly medical.
Right, I got you.
So my background is in kind of psychology and mental health a little bit.
Right.
When this role came available and I was looking to move back to Western Kentucky, it was a good fit.
Well, good. And of course, I know, like we were saying, the times that we live in. Of course, growing up, when I was a kid, stuff like this really wasn't. It was kind of hush hush.
Yeah.
You wanted to keep it down low. It's not something to say that it was embarrassing to have issues, but you just didn't talk about it. And of course, we all struggle with so many things, and especially the times that we live in with what's going on in the world. With the past year and a half, and I think we're finally getting out of COVID.
Don't jinx it.
Don't jinx it. That everybody was cooped up. Mm-hmm. And I know that can play into.
It absolutely does.
And I'm sure you guys have seen a lot.
Yeah, there was a definite increase in overdoses and overdose deaths throughout the span of the pandemic, just because mental health plays such a huge role in addiction.
Right.
So people are often self-medicating to cope, and if they can't get out and they can't do things, they might have lost a job, they might have lost loved ones to COVID.
Right.
They often looked at as a coping mechanism.
Right. And I know that's something that I know a lot of us, and me, anybody who knows me, I'm one that kind of keeps to themselves, and I speak when spoken to, that kind of a person, and tend to deal with things different than a lot of people do. I think I internalize more things, and a lot of people, they are more aggressive with the way that they deal with things. But I know with what we struggled with, all of us struggled with COVID, and not just COVID. You mentioned loss of a job, and it can be the deterioration of a marriage, maybe, or loss of a loved one. That really plays a lot, and I don't want to use the word addiction. I don't want to use that word, but we all get caught up in things. Absolutely. And we all have our own things that we struggle with that takes us away from the world, and that's what you guys are here for, to help us get back to reality and normal life.
Yeah. So we see patients with any sort of chemical dependency.
Right.
In our Madisonville Center, I'd probably say that methamphetamine is our number one substance. Opioids and alcoholism are probably the top three, or some combination thereof. Oftentimes there's a lot of polypharmacy. People will often use meth and then use an opioid to help bring them down.
Right.
So it's really a wide mix of people that are coping with those substances.
Right.
And a lot of people, that there's still a lot of stigma around addiction. It's gotten a lot better, but there still is a lot of stigma.
Right.
I think right now it's hard to find someone who hasn't been affected in some way, whether they themselves have struggled at some point or they've had a loved one or a friend that has kind of gone through that journey, so people are more willing to talk about it than ever. Unfortunately, it's not going away, but we're happy to be there and be there to help.
Right, and I think the world that we live in, it's a very much right now, I need it now kind of society, and the patience that people don't have patience anymore. It's got to be right now, and that plays an part with, like you mentioned, meth. And I know the area that we live in is a very high area for that, and especially alcohol. And but we see a lot of this, affecting. Of course, my daughter is a senior in high school, and what we see in not only in our school system, how it affects our kids, and I'm sure you guys do a lot with our youth, because this is broken homes. I know plays a lot.
Yeah, it does. There's a lot of factors that go into addiction. Nobody wakes up one morning and says, "I'm going to be addicted to meth today."
Right.
There are a lot of things that got them onto that path. Some of them are choices, but a lot of them aren't. They may have come from a broken home. They may have had drug use in the home. There are a lot of different factors that contribute to that. And what we want to do is give people tools to put in their toolkit so that they can cope appropriately without having to use the drugs. So we do a lot of counseling. We do group and individual. We're looking to hire for peer support, so someone that is in recovery, they're stabilized, they're in a good place, so that our patients have a person they can relate to and talk through their journey, so they can see someone that's been successful. So we're really excited to be able to add that person to our team whenever we find someone that's a good fit. It'll make a huge difference.
I'm sure. It's a lot of the times we don't, like I said before, we may feel embarrassed to say, "Listen, I've got a problem I need help with," because a lot of the times, we don't want to go forth and say, "I'm needing help," because it makes us look weak, and we don't want to look weak, and especially the society again that we live in, we don't want to look weak, but we need help, because a lot of people they look to all kinds of drugs to numb that pain, the loss of a marriage, a death in the family, a job, no matter what it may be, to take them out of the reality, so they don't. And of course, any kind of chemical dependency changes that mindset.
It does.
And of course, and then that brings your health down. And so, what kind of? You said you had inpatient.
We are all outpatient.
All outpatient, okay. And but the group therapy, to find people who are willing to say, put it all out there. And a lot of times what you got to do is you've got to get it out and put it all out there on the line to show people, listen, I'm weak, I need help, and it's nothing to be ashamed about.
Yeah, vulnerability, especially in today's society, and especially with men even, we're taught, we don't ask for help, and you need to be strong, you need to figure it out, but that's not the case with most things. Everybody has something they struggle with, whether it's a chemical dependency, mental illness, finances. Everybody has something they're going through. So just being able to talk to someone that's going through something similar and know that you're not alone. I don't want to say misery loves its company, but it always makes you feel better to talk it through with someone and have that empathy with them. And someone that's coming from a similar situation, it's super helpful just to have that support, and it almost becomes a family in a way, because they support each other, they believe in each other, and a lot of people, and I'm guilty of this too, a doctor or somebody, a counselor or a supervisor, anybody tells you to do something, you're like, I don't want to do that. I don't have to do that. Like I had a doctor once, and she's like, you need to eat more blueberries. I'm like, why am I going to eat more blueberries? But if I had a friend tell me, hey, I ate a lot of blueberries, that really helped. Not that that's going to happen. But I'd be more likely to listen to that friend than I would to my doctor. So that's a really important personal piece.
Well, I think we all have that mentality of like, I'm right, you're wrong. But sometimes we've got to learn the hard way. A lot of people are like that. They've got to learn the hard way, and you guys are there to kind of step in and block that off, saying, listen, we know what we're talking about. We're here to help. But a lot of people, they don't, that empathy, they're lacking that empathy in their lives. They've never been shown that people care, that people care about them, and that a lot of people aren't willing. We're not going to say willing, but a lot of people don't want to say, I'm here to help. Mm-hmm. They don't want to step on anybody's toes.
Yeah.
You know, and maybe overstep their boundaries. But with you guys, it's there, you know, and you're there to say, listen, we're here to help. All you got to do is just come to us.
Yeah.
And whatever, you know, we're not going to turn you away for whatever it may be you're dealing with. It's, you know, us. We're a family. And we're all, of course, we're all in this together. We're all in this world together. And we've all got to depend on everybody, you know, the people around us. And all it takes is just that first response, you know, saying, I need help.
And we want to make sure that that first experience is a good one.
Right.
You know, because so many times people will go to different places, you know, several times and try to start recovery, and something happens, or they're not getting the care or the response that they need. So we want to make sure that everyone feels positive when they come in. Our patient service representative, her name is Brenda. She's like our front desk person. She's the happiest person I have ever met. And she really makes our patients feel like family. Our counselors are fantastic. Linda's a really great person because she's somebody that's going to do anything she can for you, but she's not going to do it for you either, you know, so really making sure we have that accountability. Our case management piece is probably my favorite thing that we do, just because I don't think a lot of people think about the other factors that go into the disease of addiction. Like you said, you know, has someone lost their job? Have they lost their kids? So the case manager meets with a person on their first appointment. What do you need to be successful? Do you need help finding a job? Do you have a driver's license? Do we need to help you apply for Medicaid? Later on, you know, let me show you how to apply for jobs. Can I help you with a resume? Do you need help finding housing? Are there any other issues, you know, maybe domestic violence or food insecurity that you're dealing with that are contributing to your addiction, and trying to match them with those resources? And I think that's a huge piece, because it's not a one-sided issue.
Right. It's not. And, you know, a lot of us, I know I was very thankful I'm very thankful to have been raised the way that I was. But, you know, as I've gotten older, I've had my own problems, you know, because you reach a certain age where you're saying, like I said before, I'm right and you're wrong, you know, and we go through those phases to get where we're at. And the struggles with addiction, as you said before, we all have, my addiction may not be your addiction. What troubles me may not trouble you. And I think a lot of people, they reach that and they see a person like that. Well, why can't you just snap out of it? Why can't you not just put it down? Like you look at someone who has smoked cigarettes for 40 years. Why can't you put it down? Why, you know? And to be there to have someone who just understands. You know, and I know maybe smoking cigarettes is a little trivial thing, but they're all big because it keeps you from living your fullest life. And that's what you guys, I love to see this, because it's, when Tom, we were talking about Tom before, when he was telling me about BrightView in Madisonville, I love to hear things like this. Love to hear the positivity that comes out of situations like this, because helping to turn a person's life around, you can be 18 years old, and I'm sure you have probably dealt with younger than 18, but you know, from 18 all the way up to whatever age comes in, you know, people, especially in the world that we live in, need to know that people care. They need to see, just like you were talking about your front desk, Brenda, is that her name?
Yes.
Saying that when they come in, she always greets them with a smile. People need that.
They do.
Just the smile could be the best medicine of everything.
And people that are struggling with addiction, they've been talked down to for so long. They've felt ashamed. They felt guilt. They don't need anyone to tell them that they've messed up. You know, they know they're in trouble. That's why they're there. So we just want to be there to be a support system and to be empathetic and to help them succeed. You know, we do only treat adults. So, you know, we've got patients 18 all the way up until their 70s.
Really?
You know, and it's really interesting in hearing people's stories. You know, a lot of people, they may have been using since they were a very young teenager. You know, there were drugs in the home. Their parents may have even gotten drugs for them. And then some people, you know, it's just they had a life event and they turned to alcohol, or whatever it may be. We have people that you would never imagine. They aren't the stereotypical person with addiction. We have patients with master's degrees and that have great careers. Yeah. And something happened, and they turned to that to cope. Yeah. And they've realized that something's going on. Yeah. And that's another benefit, too, to outpatient, is that those people can keep their jobs. Mm-hmm. They can keep their kids if it's safe. They're not going to lose their insurance because they can just come when they need to. Yeah. So that's really important. And, a lot of people, there is a problem with opiates in society, and it's taken a long time to get into this mess that we're in, so it's going to take a while to get out. Yeah. But a lot of people, even it could have been a sports injury or a fall or whatever it is, they were prescribed opioids and opiates, and they've kind of developed a pattern where they need that to function. And that's not necessarily a choice they made. They were prescribed it. They thought they were doing the right thing. But people's brains work differently. Yeah. Brains are weird. Yeah. Brains are weird. Mine works different than yours, and everybody else's is so different. Yeah. And the brain with addiction is different even still. Yeah. Those neurons aren't firing like they need to. The dopamine and the serotonin and all those chemicals have gotten kind of jumbled up. Yeah. And it's going to take a little while for them to get back to normal, whatever that means. Yeah. I don't know that anyone's brain is normal.
I don't think in our society normal is what is normal anymore.
Yeah, but at least, a more stable state. It takes a while. It takes a while.
It does.
And it's hard.
It's very hard because, like you were touching on the way someone was raised. That may have been all they've ever known. And of course, it's something that's always bothered me is, you see so many kids that grow up in these households where, it's either just one parent or, the parent goes and leaves them to fend for themselves, and they turn to other things to help them cope. And it's all they've ever known in society. And then with the society that we live in, again, that friendliness, that love that so many of us preach about, but we don't exhibit. Mm-hmm. And to have that constant there, people need to know that, we're about love. We're about helping one another, to lift one another up. And, of course, growing up, I was born in the 70s, grew up in the 80s. And, a lot of the stuff that we see in our society today, I could never have dreamed about. Yeah. And especially with my daughter being 17, the stuff that she knows at 17, I never knew. Mm-hmm. That I'm just finding out now at 44 years old. And you do get to that point where even, like you said before, we all have problems. Where you can sympathize with somebody. Because coming out of COVID, I'm just using COVID as an example, but coming out of COVID, we were all, I know, just every single one of us were about to pull our hair out, because of what we were all going through. Some of us dealt with it in a different manner than what other people did, because some of us had that family unit there in turn to some people don't. Right. And I want to go to COVID. How did COVID affect you guys during this?
Well, our center actually opened in May of this year, so we missed the whole 2020 piece.
Well, good. I guess that's a good thing, maybe. In a way.
In 2021, it's been a little crazy too with the back and forth. Right. I don't want to take 2021's thunder or anything. Right. But like I said, there really were. We saw a big uptick in overdoses throughout the pandemic, just because people couldn't cope. Right. We also saw an increase with stimulus checks.
Yeah, and I know. Has probably played a big part into a lot of this. And I hate to say, I don't want to say free money, but you get that money, and for someone who is struggling, it's turned to something else then. So, and I'm sure it's not just what we mentioned. I'm sure gambling is a big. Is that something maybe you guys?
We focus more on the chemical dependency, So, but if somebody did have a problem with that, we could help refer them. Right.
Right. Exactly. Well, I know this like I said, this is great, Alex. I know that you got a big day ahead of you. I know you got to go to Benton, but I want to give you guys some little info on BrightView. Of course, they are in Madisonville,
Coming soon to Benton.
Coming soon to local. Where is Madisonville in?
Madisonville and Benton are going to be your closest two.
Okay.
Don't know where you guys are watching and listening from. We also have centers in Henderson, opening one in Litchfield soon. Glasgow, Campbellsville. And then over into like Lexington, Louisville, that stuff as well.
Okay.
Yeah. If anybody's in Ohio, we have centers everywhere in Ohio.
Really?
So
I mean, this is really great.
Yeah. Well, our founder was an ER doctor.
Okay.
And he saw people coming into the ER that they could have had any issues, but if they had an underlying substance use issue, they were usually treated as less than, and they just kind of handed them a paper. Yeah. Like, hey, we can't help you. You're on drugs.
Right.
Go get help.
Right.
That's not.
Well, I think
not helpful.
I think that's something
that's how we ended up here.
That's lost is, people don't look on the mind. They just look, the mind is a muscle just like anything else in your body, and it gets sick just like your heart, just like your kidneys or your liver. You get sick, and your brain gets sick, your mind gets sick, and people tend to lose that. It's just, you can get over it, and that's not the way it works.
Well, yeah, it'd be great if it was.
It would.
But brains are weird. Like I said, brains are weird.
Yeah. Brains are very weird.
Strangest organ.
And with everything that the brain has to deal with, why would it not go sick? And of course we do make our own choices. But it's just like anything, when you exercise your body, you get stronger. And if you're putting the environment that you're in plays a toll on your mind, and it'll make it either weak or strong. And so to be, I think we've had my mother-in-law. She's a nurse at the hospital here. So the things that she has to deal with, and I know you look at someone who's in the nursing field who's just come out of COVID and what they're dealing with at the nursing home, at the rest homes, what they've had to deal with, with their patients not having to be able to see family because it that takes a toll on your mind. I know if I'm away from my wife and daughter for more than a day, I get lonely. That plays a part on when you've always had that there. So many different things can affect your mind. And of course now we're heading into colder weather and the Christmas season, and I know that affects a lot of people. Especially during Thanksgiving and Christmas. Because, like I said before, a lot of people don't have that family unit at this time of year. And I know this is one of we were talking yesterday how we all have our certain, I guess, things that affect us. I'm one who, October always affects me because it's fall and it's dreary. And I'm so proud because the only thing I was saying yesterday, the only thing in October that I like is my wife and I, our anniversary month. And so that's the only thing, that keeps me, I hate to say the word sane, but that's the only thing that it brings me up. But it just seems like we all have those things that bring us down. And with Thanksgiving and Christmas coming, and just being able to focus on what's good in life, and because life is good, it is. Life is very good, and when you have those people there to support you, to be there, some people just need a pat on the back, and just say, you're loved, and give a hug, give a smile. And
if life's not good right now, it can be.
It can because we all have. I know we can all find something to bring us down, to be depressed about, but I often say, and sure you've heard this before. If someone asks me how I'm doing, well, I could complain about something, but no one would listen to me. There's someone there to listen to you. I know we all throw that around like a joke, but there's someone there to listen to you.
We're here. We're here. And we have a lot of patients. They even stop in. They have to talk to Brenda, even if they don't have appointments.
Right.
She's that good.
Yeah. So that may be all they need.
Yeah. Sometimes they're like, I'm just had something happen. I knew you'd listen. I knew you'd be there.
Yeah.
And I think all of our staff is like that.
Yeah.
I think all of our staff is like that. They genuinely want people to be successful. And the coolest thing that we've been open about 6 months or so, we've got a couple of patients that have been with us since early on, and they've started to be successful. Their body condition has changed. There's a light in their eyes again. They're working when they've been out of the workforce for so long, and it is really cool.
Yeah,
it is really cool.
That's so great because I know that I've always been one of these people to where I don't want anybody around me to be upset. It's funny because between my wife and I and our daughter, I know growing up, our daughter would always call me mom and call her dad because of our personalities. But not to say not knocking my wife, but she's the extrovert. I'm the introvert. So, and I take a lot after my mom. And anybody who knows my mom, like, we could be here all day talking about my mom. But that I just want people around me to be happy. I don't want to upset the boat, you know. So people need to just lift each other up. And there's what harm is it going to do? Even if you don't agree with the person, you know, none of us are going to agree.
No.
Just say, I love you, you know, we may not agree. Our personalities are different. That could help a person more than anything.
Oh, yeah. We're all human.
Yeah.
At the end of the day, we're all human.
Yeah.
And that's bigger than anything.
Yeah. And that's something that's lost. You know, we're all human. And, you know, that right there hits the nail on the head. We're all human. We're all, I hate to say, we're all broken. None of us are perfect. And we've all got our problems. And to have you guys here just to help, I know just having you in here this morning, you've been calm and just, you know, great to talk to. And just
I appreciate you having us out.
Listen, anytime. I like to have Brenda on because it sounds like Brenda could come in here and just brighten the whole room up.
I mean, she would.
Yeah, I'm sure she would. I haven't even met you, Brenda, and I'm sure you're watching this. And I'm sure you've brightened my day just to hear the stories about you. And you know, but that's something about coming in here to our job is we're a family. Well, I mean, we're truly a family here, and to be able to bring things like this to people who might not be able to, you know, get out of their house or whatnot. But you know, we look on what we do here as a family. We're a ministry. We have people come in just to talk to us, just to say hi, and you know, if we can brighten people's day just by coming in here, you know, that's what we're here for. So, and I think that's what we're all here for. But Alex, I know you've been a complete pleasure to have in this morning, and I hope next time we'll have to have you on again. The next time you're going to have to bring Brenda.
Okay, she'll do it.
We'll sit down and do an interview with all of us. But guys, BrightView is in Madisonville, and they are located at 9 East Arch Street, and that's Madisonville, Kentucky 42431.
It's the old family video, if that helps anybody.
Okay. And the phone number is 1-859-407-6186. And, of course, you can go to their website, which is www.brightviewhealth.com. And I will put all this in the bio below the video later on when you guys go to watch it, and also on YouTube. So be sure to go to our YouTube channel later on today. We'll have a edited version of the video up there so that you can watch, and we'll have all of the info there as well. But I know that 24/7 care, right?
We've got a 24/7 helpline. So if you need to talk through some stuff, you might be interested in getting treatment, you can call that anytime. Also, we take walk-ins until 3 o'clock every day. So if you're out there, you're listening, and today's the day, come see us. If you know someone, just tell them whenever they're ready. We're there. We take all insurances, Medicaid, Medicare. If somebody can't pay, we're not going to turn them away.
Good.
There are enough barriers to seeking treatment. We don't want payment to be one of them. PACS can help transport if you have transportation issues. So we try to make it easy.
Yeah.
We try to make it easy.
And that's what we need.
Recovery is hard, and we don't want to make it any harder than it has to be.
Yeah. Well, good. Alex Strein, right?
Yes.
Alex Strein. I want to make sure I get that. I'm bad about pronouncing names. That's one of my faults. Is I'm horrible at pronouncing names. But I want to thank you for coming in this morning.
I so appreciate you having me out.
Get a hold of Alex. I'm sure she would love to talk to you. BrightView. I'll have all the info in the bio later on for this video, and I just want to thank everyone for tuning in this morning. This has been great. Again, you've brightened our day by coming in here with all the information that you've provided us with, and I know she's on her way to Benton today, so we're gonna let her get on her way, and I hope we haven't taken too much of your time this morning.
No, it's perfect. I enjoyed it.
Good, and again, we'll have to have you and Brenda back.
Yes.
Brenda, I'm gonna hold. I haven't met you, Brenda, but we're going to hold you to that, and I'm going to hold you to it, to come in here and sit down and talk with us, and maybe about how you your viewpoint on what you deal with and what you see at BrightView. And but guys, I want to thank you again for joining us this morning. We will be again edited version on YouTube later on today. And again, Alex, thank you for stopping in and chatting with us and everything that BrightView has to offer.
Thanks so much.
You're welcome. Guys, we'll see you again. Bye.